Namaste and welcome back to the series on hypospadias. Now we will move forward from the distal cases and the description of the procedures which were single staged. Now we will begin with the two-staged procedure by Bracka, and in these cases what happens is that the urethral opening is much more proximal, the urethral plate is not of good quality, and the chordee is more pronounced, and therefore they are done in two stages. Now the perioperative considerations are going to be similar to that have been described before. So in the first stage, the initial part is to identify the urethral plate. Now this is the opening of the urethral meatus. So the urethral plate is outlined, and since this is not of good quality wherein we can tubularize it like in case of Snodgrass procedure, what is done over here is that after the degloving as required and the release of the chordee, the gland's wings are opened and the urethral plate is outlined. Now a graft is harvested in the first stage. This can be from the inner prepuce, which is of a good quality, it is of a good match, it's like with like, or a buccal mucosal graft from the buccal mucosa or from the inner part of the lower lip also can be harvested, and according to the amount that is required, it is quilted over the urethral plate. Now this is the catheter which is shown over here. So that is left in place where the urethral opening is present, and the graft is carefully quilted over the entire surface of the urethral plate. Now to make sure it stays in position, a good tie over dressing is done so that we have good adherence and good take of the graft. Now the catheter is again left in place, the diversion is left in place for about 5 to 7 days, and gradually it is removed, the tie over dressing is done. But for the graft maturation, we have to wait for a period of 6 months. So the second stage of Bracka is described originally as that which takes place after a period of 6 months, because we want a good graft maturation to take place. So now before the surgery, again the urinary diversion tube, the catheter is placed. Now over here, as opposed to the Snodgrass procedure wherein the urethral plate is incised down in the midline, this is incised on all the edges. So once this graft is lifted on the sides, the catheter is passed through it and the graft is folded onto itself and it is sutured. It is sutured to form the tube over it, and that is how we are going to tubularize the urethra. Now a waterproofing layer, which can be from the dartos muscle or from the tunica vaginalis, is also always recommended, because obviously it decreases the incidence of leak, that decreases the incidence of fistula formation, which is quite commonly seen in case of hypospadias, and ultimately the closure is done with the closure of the glandular wings and the skin over the shaft. So this is a quick description of what is seen in the two-stage Bracka procedure, and in the following videos I will describe the other two-stage procedures as well.